Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Cancer stages. Early to advanced tumor traits. Cancer staging involves defining the severity of your disease based on how much cancer is in your body. It describes the extent to which the disease has spread and, if so, how far it has spread from the primary site. While every person's disease is unique, each stage of colon cancer tends to have a similar prognosis and treatment options across populations. /r/n/r/n colon cancer occurs when cancer cells grow in your colon, large intestine. While the term colon cancer is often used interchangeably with the term colorectal cancer, they are not the same. Colorectal cancer refers to any cancer of the large intestine, which includes both colon cancer and rectal cancer. /r/n/r/n The 4 stages of colon cancer are numbered 1 through 4. Stage 0 is a preclinical stage. The lower the stage number, the less your cancer has spread. Higher numbers mean that the cancer has spread more. /r/n/r/nPhoto composite by Michela Buttignol for Verywell Health. Getty Images /r/n/r/n colon cancer is staged at the time of your diagnosis before treatment begins. It does not change even if your disease improves or worsens. /r/n/r/n colon cancer is most often staged using the American Joint Committee on Cancer, AJCC, guidelines. These guidelines use pathological staging, which determines the staging based on tissue removed during surgery. /r/n/r/n clinical staging, which stages cancer using results from physical exams, lab reports, and imaging tests performed before surgery, is considered less accurate than pathological staging. /r/n/r/n The AJCC uses the TNM system, which evaluates 3 key pieces of information to determine cancer staging. Each letter refers to a specific disease characteristic. /r/n/r/n within each stage, the letters T, N, and M are followed by numbers or letters to provide more details about these factors. When the T, N, and M categories are determined, it is combined in a process called stage grouping to assign an overall stage to the disease. /r/n/r/n Based on the AJCC system, the stages of colon cancer include /r/n/r/n Stage 0 cancer is considered a preclinical stage of colon cancer. It involves the following features. /r/n/r/n Stage 1 cancer is the earliest stage of colon cancer. It involves the following characteristics. /r/n/r/n Stage 2 colon cancer has metastasized outside your colon to invade the surrounding tissue but not your lymph nodes. Stage 2 cancer is subdivided into subcategories 2A, 2B, and 2C. /r/n/r/n Stage 2A, /r/n/r/n Stage 2B, /r/n/r/n Stage 2C, /r/n/r/n Stage 3 colon cancer has spread into nearby lymph nodes but has not metastasized, affecting other areas of your body. Stage 3 is divided into 3 categories, each of which has additional subcategories. /r/n/r/n Stage 3A, /r/n/r/n or Stage 3A can involve /r/n/r/n Stage 3B, /r/n/r/n or Stage 3B can involve /r/n/r/n or Stage 3B can involve /r/n/r/n Stage 3C, /r/n/r/n or Stage 3C can involve /r/n/r/n or Stage 3C can involve /r/n/r/n Stage 4 cancer, also called metastatic colon cancer, involves cancer that has traveled through your lymph system and bloodstream to other parts of your body. With colon cancer, the lungs and liver are the organs most often affected. /r/n/r/n stage 4a, /r/n/r/n stage 4b, /r/n/r/n stage 4c, /r/n/r/n stage and grade are two ways to describe the severity of your colon cancer. Each term describes a different aspect of the disease, as follows: :r/n/r/n Your colon cancer staging can impact your disease prognosis, a prediction or estimate of the chance of recovery or survival from the disease. A prognosis is typically based on statistics calculated on how a disease acts in studies of the general population. /r/n/r/n It's important to understand that since your prognosis is based on average statistics, it means that there is always the chance that you will do better or worse than what is considered average. /r/n/r/n Many factors can influence your colon cancer prognosis. These concerns include /r/n/r/n A cancer prognosis usually considers the 5-year survival rate. This represents the percentage of people in a study or treatment group who are alive 5 years after they were diagnosed or started treatment for colon cancer. /r/n/r/n In the United States, 5-year survival rates for colon cancer as reported by the Surveillance, Epidemiology, and End Results, SEER, program include /r/n/r/n While the tumor characteristics in colon and rectal cancers have similarities, they are two different conditions. These two types of cancers are often grouped as colorectal cancer to describe all cancers of the large intestine because of their similar risk factors, symptoms, incidence rates, and the genetic makeup of people affected. However, these cancers also have differences that can impact your treatment and prognosis if you are diagnosed with either condition. /r/n/r/n Colon cancer is considered a highly treatable disease. It can often be cured when diagnosed while it is still localized to the bowel and has not spread to involve other tissue or organs. Surgery is the primary form of treatment. It can achieve a cure in about 50% of people with colon cancer. /r/n/r/n While surgery can be successful, recurrence following surgery for colon cancer is a significant problem. Recurrent colon cancer can often be more complicated to treat than the initial disease. It is often the ultimate cause of death, which is why cancer survivors are advised to visit their providers regularly after treatment concludes. /r/n/r/n A diagnosis of colon cancer can be devastating news. As you begin to process this information, you will have to make decisions regarding treatment and lifestyle changes. The urgency of making these decisions will be determined by the severity and location of your colon cancer. /r/n/rn Here are some next steps to ensure that you get the best possible care if you are diagnosed with colon cancer. /r/n/r/n Talk openly with the healthcare provider who delivers your diagnosis. Don't hesitate to ask as many questions as you need to in order to clearly understand your medical condition and recommended next steps, and treatment options. /r/n/r/n Take time to write or record their answers since it will likely involve a lot of new information all at once. If possible, take a family member or friend with you so they can take notes while you discuss your situation. /r/n/r/n Getting a second opinion on your diagnosis and treatment plan is always a good idea. This may be valuable if your cancer was discovered by a healthcare provider who does not specialize in your type of cancer. As part of the process, ensure that the second healthcare provider has access to all the medical records and imaging tests used to determine your diagnosis. /r/n/r/n Learn all you can about colon cancer and how to cope with it. The more you know about colon cancer, the easier it will be to discuss your condition with healthcare providers and participate in decisions regarding your treatment. /r/n/r/n You can investigate treatment options through the National Cancer Institute's Cancer Information Service, which can provide recommended treatment plans from the National Cancer Institute based on your diagnosis, the location of your primary cancer, and the stage of your colon cancer. /r/n/r/n. After you get a second opinion and gather the information you need to make an informed decision, you should prepare to make decisions regarding your treatment plan. These choices will involve the type of treatment you receive, where you receive it, and who administers it. /r/n/r/n. Your involvement in ensuring you get the best possible care does not stop with choosing a treatment plan. Stay as informed as possible about what is happening and how it affects your progress. Talk to your healthcare provider about ways you can work to stay healthy and fit to support the success of your treatments. /r/n/r/n. Depending on your medical condition and living situation, you may benefit from using support services during and after your treatment. This can be helpful if you don't have family or friends who can lend a hand. /r/n/r/n. If that is the case, check with your healthcare provider or cancer treatment advocate to learn about the resources available to you through your health insurance, local social service organizations, and volunteers. /r/n/r/n. While money is likely the last thing you want to worry about when you receive a diagnosis of colon cancer, you should determine the cost of your treatment and how you will pay your portion of the costs. /r/n/r/n. Contact your health insurance plan to find out about your plan limits and how you can make the most of the coverage you have. This may affect where you receive treatment and the type of treatment you can afford. /r/n/r/n. Determine how you will deal with time lost from work and if you qualify for disability insurance. If finances are a problem, discuss your situation with your healthcare provider, who can direct you to resources for financial assistance and financial aid. /r/n/r/n. As a person with cancer, you don't have to feel that the future is out of your hands. Remain actively involved in monitoring your progress. Contribute to your health and well-being by making the recommended lifestyle changes to support your treatment and recovery. /r/n/r/n. Observe your healthcare provider's advice for follow-up care after your treatment ends to remain as healthy as possible and monitor your health for signs of recurrence. /r/n/r/n. Recurrent colon cancer is colon cancer that returns after a period called remission. Remission is a partial or total disappearance of colon cancer signs and symptoms after treatment. /r/n/r/n. Among people treated for colon cancer, about 30% to 40% develop recurrent disease, with the risk of recurrence lower for people diagnosed with stage 1 disease versus stages 2 or 3. /r/n/r/n. When colon cancer recurs, it usually appears as a distant metastasis in your liver or lungs. When it recurs locally, it affects the pelvis or peritoneum. Most recurrences of colon cancer occur within the first 2 to 3 years after treatment for the initial disease. /r/n/r/n. In most cases, the formal stage of cancer remains the same as when it was first diagnosed, even if it returns or spreads after a period of remission. Under certain circumstances, recurrent colon cancer may be restaged, though it is uncommon. /r/n/r/n. If your healthcare provider decides to restage recurrent colon cancer, the same exams, imaging tests, biopsies, and surgeries used to stage the initial disease are repeated to identify the new stage. When a conclusion is reached, the new stage is identified with a lowercase r before the recurrence or a treatment stage. /r/n/r/n. Colon cancer staging helps describe the extent of your disease so healthcare providers know how much the disease has spread and if so, how far. Staging is used to make decisions about your treatment and determine a prognosis. Surgery is the standard treatment for colon cancer in stages 1 through 4. /r/n/r/n. While useful, colon cancer staging is only one part of your disease story. Factors such as your age at diagnosis, tumor grade, and other health conditions can impact your disease outcomes. /r/n/r/n. Getting an early diagnosis and treatment is the best way to improve your results. Maintaining a schedule of follow-up appointments and screenings as advised after treatment can support your long-term success as a colon cancer survivor. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.